Welcome everyone to another one of our 12 Days of Wellness segments here at Ogden Clinic. Today I am joined by Dr. Brett Martindale at our Professional Center South location. Can you tell us a little bit more about what you do here?
Yeah, so I do sports medicine. I work very closely with the orthopedic department, so I do the non-operative stuff. I don't do surgery or anything, but when people get an injury or a broken bone or they have a chronic issue like arthritis or tendonitis and they need that taken care of from a non-surgical standpoint, that's what I focus on.
Awesome. So today we're talking all about the colder weather and how it might influence muscle pain, joint pain, all of that. So can you tell us a little bit why the colder weather might bring on more pain?
Yeah, we don't know all the reasons why that might happen, but there's a few theories out there. One is that changes in the air pressure, the barometric pressure, might put different tension on our joints and thus cause pain. That's why people say, I can feel when a storm is coming in, or the cold weather may also cause more tension on our muscles and tendons, which then puts a little bit more pressure on those joints to cause pain, make the fluid in our joints more stiff. So there's a lot of theories of why that may happen, but I'd say another major reason is just people tend to be less active in the winter time. You know, the weather isn't as nice, it's not as warm, people don't tend to get out as much, and maybe I'm not talking as much about the skiers and snowboarders, but still generally, as a whole, people generally don't like to go out in the cold and do things, and so we become less active, our joints get stiff, and they just become more painful and achy.
That's really interesting. I know you mentioned a little bit about people that have arthritis. How might someone that has arthritis or something like tendonitis suffer more than just the average person?
It's not that it's different reasons that would cause them pain, it's just that they have underlying problems that make them more prone to those changes in weather or that change in activity level that they might undergo with the change in seasons. Because their tendons or muscles or joints already have some element of wear and tear in them, it just augments those other problems and causes more pain that way.
And what are some recommendations you would give for, someone at home that might be having pain, or how can they prevent having more pain during the winter?
There's basic things like you can do heat, whether it's a heating pad or sit in a warm bath or let the warm shower, run on your joints or aching muscles or tendons. That's perfectly fine to do. Of course, people could use some anti-inflammatories or Tylenol to help with their pain or discomfort. That's all appropriate to do. But I'd also encourage people to keep active, stay physically active during the winter months. That can still be very helpful in helping with that pain from joints and muscles and tendons and such.
Another thing too, I think a lot of us tend to think about joint pain, muscle pain as something that affects an older generation. But is this something that can affect all age groups?
Absolutely it can. I mean, obviously, the older we get, the more wear and tear our body undergoes, and certainly the older we get, the more prone we are to those things. That being said, based on the activities that we choose to do and the injuries that we sustain or how aggressively we do them, any age is prone to these issues, from a child who's just growing or hitting their growth spurt to a teenager or a 20 or 30-year-old to the middle age to the older generations. Everybody can be affected by these issues. And so these same recommendations apply to all ages.
That's really great information. And it's good to know that all of us can kind of suffer during these winter months. Another thing I want to talk about, and I would like for you to share more about, is you mentioned you run the Ortho Express clinic as well. Can you tell us more about the services you offer, what you do there?
Sure. So the Ortho Express is designed as a walk-in, same-day type of clinic, particularly for people who have sustained an acute injury, meaning an injury right soon before. So whether it's you twisted your ankle last night playing basketball, or you took a spill down the ski hill the other day and you're still having some aches and pains and you're concerned about something, that's the situation we're there for. But a lot of those things we can take care of in a non-ER setting, which can save people a lot of time and a lot of money from those situations, but still get the same level of expertise because we're staffed with sports medicine and orthopedic providers. And as opposed to urgent care, which again is not a wrong place to go, but they may not have that same level of expertise as the Ortho Express. And so the things that we deal with in clinic it can be a simple thing like a sprain, or you just twisted your ankle or your wrist funny, but it can even be broken bones. I mean, we've treated several broken bones, several dislocations in our ortho express clinic. And so even those things, because it's staffed by the orthopedic providers ourselves, say in the ER and they need someone to come and reduce a fracture. I mean, these are the same people who do that. We're just doing it in this outpatient setting where it can, again, be a lot more timely and a lot less expensive.
That's awesome. That's a really great service. Obviously in the winter, I'm sure you might see a little bit more injuries, people slipping and falling, or people that are skiers doing winter sports might have a little more injuries. So it's great to know that we have this service here at Ogden Clinic. Now, to wrap it all up, since this is a holiday segment, I do have a holiday related question for you. What is on your Christmas wish list this year?
Oh man, I anything golf related. I really like golf, and even though I can't go out and golf right at the moment, if anyone in my family or friends get me anything golf related, I'll probably be happy.
Awesome. Well, hopefully you can start golfing soon. It's probably a couple more months till you
it's
do
a
that.
little while yet, but
well, thank you so much, Dr. Martindale, for
No problem.
sharing all this awesome information with us and telling us a little bit more about the resources we have here. That wraps it all up. We wish you all a happy holiday, and thank you so much.
Thank you very much, and Merry Christmas.
Thank you.